Okay, so today we are going to discuss about disease known as Addison disease. It is called adrenal insufficiency. Adrenal means adrenal gland, insufficiency means insufficient hormone release. In this disease, body does not produce enough or certain amount of hormone is called Addison disease or adrenal insufficiency. Adrenal glands which are present on the top of kidney produce too little cortisol and often too little aldosterone. So adrenal gland has three zones. In every zone has its own function. Zona glomerulosa, one is zona glomerulosa and other is zona fasciculata and third one is zona reticularis. So these three zones produce different type of and hormones: aldosterone, cortisol, and steroids. So, these hormones are insufficient in adrenal insufficiency or Addison disease, and patient will present with certain amount of clinical features and complaints. Incidence of Addison disease occurs in all age group, present in the both sex, and can be life-threatening in Addison disease. And primary causes of Addison disease are autoimmune diseases in which body's immune system mistakenly attacks adrenal gland, or a virus, bacteria, or any outsider invader. And other causes are primary adrenal insufficiency, includes prolonged administration of glucocorticoids like prednisone, causes suppression of adrenal gland, infections, cancer or tumor, certain body thinners used to control clotting in the body. And secondary Addison disease is secondary causes are uh, tumor, medication, genetics, and traumatic brain injury causes adrenal insufficiency. What are the risk factors of the adrenal insufficiency? Cancer, taking anticoagulants, blood thinners, having chronic infection like tuberculosis, had a surgery to remove any part of the body, having autoimmune disease like type 1 diabetes mellitus, and Graves' disease can also cause Addison disease. So as we discussed, that Addison disease patient feels extreme fatigue, weight loss, decreased appetite, darkening of the skin, and hyperpigmentation. This one is the high yield point. Low blood pressure, hypotension will be present because of aldosterone deficiency, salt craving, low blood sugar, hypoglycemia because of cortisol deficiency, nausea, diarrhea, vomiting, abdominal pain, muscular joint pain, irritability, depression, hair loss of the body, and sexual dysfunction in women. These are the symptoms of the Addison disease. How can we diagnose the Addison disease patient? We will take the complete history and physical exam of the patient. We will perform blood tests like uh, measure of sodium, ACTH, cortisol, and ACTH in the body. ACTH stimulation test will be performed, and X-ray of adrenal gland will be performed in order to rule out any disease of Addison disease in the patient. We will also perform CT scan and X-ray, and CT scan and X-ray we will perform, and we will diagnose the Addison disease. Adrenal crisis causes low blood pressure, high potassium level, and low blood sugar. Low blood pressure because there is decreased aldosterone level, and high potassium level because there is decreased sodium results into increased potassium in renal tubule. Low blood sugar leads to because of there is deficiency of cortisol. Deficiency of cortisol leads to decreased blood sugar, and the treatment of Addison disease is hydrocortisone pills to replace cortisol. If the patient lacking aldosterone, so fludrocortisone should be given to the patient, and patient taking fludrocortisone needs to increase salt intake in order to compensate sodium level in hot and humid weathers. And emergency during surgery, medication is given IV directly in the vein. So that was the Addison disease, in which we studied that patient will feel fatigue, hyperpigmentation, hypotension, hypoglycemia, and the treatment will be accordingly. If there is cortisol deficiency, hydrocortisone is given. If there is aldosterone deficiency, glucocorticoid is given to the patient. Patient will have salt craving. Patient will have hypotension, uh, uh, hyperkalemia because of increased potassium level.